located in Aizawl, the capital of Mizoram, India. I welcome all the honorable guests, including our Honorable Vice Chancellor Professor K.R.S. Sambasiva Rao, our guest speaker, Ms. Soumya A. Rege from Texas, USA, my co-coordinator, Professor A. Muthulakshmi, Head, Department of Public Administration, Mizoram University, all my esteemed colleagues, guests, and dear participants throughout the country and outside. At the outset, it is a privilege to have this webinar today because Madam Soumya has agreed to our request in very short notice, even if she is very busy with her schedule in USA, because she has a wide range of professional experience. She has agreed to our request. So before we go for the formal thing, it is my privilege to request our Honorable Vice Chancellor, Professor K.R.S. Sambasiva Rao Garu, to speak a few words of welcome. After that, Professor A. Muthulakshmi will give brief introduction about Madam Soumya, then the talk, then question answer. This is the format we will continue. So now I request our Honorable Vice Chancellor, Professor K.R.S. Sambasiva Rao, to speak a few words. Sir.
Good evening, everyone. It was really very nice of Madam Dr. Soumya for accepting our invitation and giving a webinar to Mizoram University students, faculty, and research scholars, and also to the people from outside who are actually attending this webinar. Now, more than 100 people are there. So it was really a wonderful time that the topic is also very, very pertinent topic. And it was a very important topic now, how people after pandemic situation, how the education in India and abroad, people, most of the people in India, they like to go to US and many other countries. They have several doubts what to do. Now, can we go there or can we continue our studies or not? And the people who are staying already, they have a feeling that whether we can get a job if we go there, and what are the prospects if we go there, if we just will face any problems. A lot of issues, particularly for young students, many issues are there. And the topic selected by Dr. Soumya is very wonderful, very pertinent topic to the many students, like healthcare, how it healthcare, people after the pandemic situation. Now we are listening every day, somebody died, somebody died. But is it really true because of the corona, or it is because of the negligence, or it is because of the severity of corona, or after the corona is lifted, how people are actually to behave? How, what is the guarantee that we get? This kind of so many doubts are there. And because we are living, we are listening every day. Yesterday, 2 parliament members died. And it was really wonder how parliament members are not able to get a treatment and they are dying for this kind of problem. Is such a severe infection it is, like that many doubts are there for young children and also for many people. And that is also healthcare, how to do that. This is one of the and job prospects in US and North American cities, and also Europe. And also the pandemic scenario, how it is. Because US also every day we are listening 10,000 people or 15,000 people are getting into infected. So what way, India is almost competing with US in a #1 position with US for cases. So, but I was told that in US, the intensity of the cases has come down and also the death rate has come down. So after so many months, no, they have stabilized this situation. So in that particular experience, how it could be, how people can be relaxed in India, how it can be. So it may be a wonderful, enlightening talk for all of us, and we all be eager to listen to her, and very important topic of the particular situation. And thank you very much, madam, for accepting and also choosing very wonderful topic. And it was really wonderful. And I thank you very much for giving the opportunity for listening to you.
Thank you very much, sir. Now, I request my colleague, Professor A. Muthulakshmi, Head, Department of Public Administration, Mizoram University, to give a brief introduction of Madam Soumya before she can begin her talk. Lakshmi, please.
Thank you, sir. Good evening to India and good morning to US. I am Muthulakshmi. It is my pleasure to introduce our speaker, Soumya A. Rich. She has a brilliant academic and professional career, and she is a Bachelor of Architecture, IIT Kharagpur, and Master of Architecture, University of Texas, Austin, USA. And she is a senior management professional based in USA. Among others, she is a licensed architect, Texas, and she is a nationally accredited certified floodplain manager. Apart from this, she also has taken some of the assignments like she is a chief operational manager, facilities and property in the Department of Management, and she is a manager of architectural construction section in the Department of Engineering, and also she developed and enforced standards for training and mentoring staff, operational policies, procedures, and best practices. And she also assigned floodplain management for Harris County participation in the federal flood damage assistance program. And she also established a task force and spearheaded the implementation of a multi-million-dollar computerized management system. And also she is a project management for larger projects like construction or design, then contract project manager in the Department of Engineering. And also she is coordination with consultants, contractor and county agencies and in-house construction staff to ensure satisfactory project delivery during implementing design and construction phases. Apart from this, she is also a well-trained vocalist in Hindustani classical music. So with this brief introduction, we warmly welcome you, ma'am, to deliver lecture. So please, you take your turn, ma'am. Thank you so much for giving this opportunity to introduce you for today's webinar. Thank you, ma'am.
Thank you, Professor Muthulakshmi.
Yes,
so
thank you,
now it is a pleasure and it is my honor to welcome formally Madam Soumya. Now the time is yours, ma'am. So you can take 30-35 minutes for the talk. I know it is a very exhaustive PowerPoint presentation. So you have been very kind to us to have agreed to the webinar. Plus, you have told that if anyone wants, you can share this PPT. That's another pleasure. And with these few words, I wish I will not talk about the topic. Let the topic and the discussion come from you. And after that, we will have few questions which the participants and our friends have posted. And we received a few very interesting questions in email also, as per our invitation. So after that, let us wait for that time. Now, madam, the time is yours. You can start the talk, this healthcare and job prospects in post-pandemic scenario in USA, a citizen's perspective. Yes, ma'am.
Thank you, Srinivas. And thank you, Professor Muthulakshmi. Thank you, Professor Rao. I am very happy to be here. I will now share my screen. I hope everybody is staying safe during the pandemic. So our talk today is going to be about healthcare in the US and job prospects in the US during post-pandemic scenario from a citizen's perspective, as Srinivas has mentioned, and Dr. Rao also. This evening's agenda is going to be first, a brief overview of the US healthcare system. I would like to do that so you can understand what happened to the US during this pandemic. Then we'll talk about the impact of the pandemic on the US healthcare system. Then I'll talk a little bit about job prospects after the pandemic. And I'll touch on immigration and jobs. And I will conclude with my personal experience with the pandemic. A brief overview of the US healthcare system. How do people access healthcare in the US? US spends nearly twice what other developed countries spend on healthcare. In 2018, the US spent $3.6 trillion. The way people access insurance is in two different ways: private insurance, which covers approximately 50% of the people, and public insurance, which covers approximately 40% of the people. And that leaves about 10% of the population without any insurance at all. And so what is private and public health insurance? Private insurance is provided by a for-profit corporation and is offered in two different ways. Employers can purchase health insurance packages and offer health insurance as a benefit to their employees as part of their job offer. In this case, the employer subsidizes the premiums and the employees also share in the costs. Self-employed individuals, which make up about 30% of the workforce, they purchase health insurance on the open market. And these policies are generally more expensive because they are single policies as opposed to the group policies offered by employers. Then there is public insurance, which is funded and provided by the government at the federal, state, and local levels in three different ways. Medicare. Medicare is available only to people who are over 65 years of age. They have worked in the US for 10 years, and they have paid a Medicare tax. Medicaid is available only to low-income and indigent people. This is a partnership funded and provided jointly by federal and state governments. Then there are some local programs funded and provided by city and county level municipalities, but these are not available nationwide. They're only available in certain regions. Healthcare is very expensive in the US, and why is it expensive? Private health insurance is for profit. They're interested in maximizing profits for shareholders. They have very high administrative and overhead costs. They spend a lot of money on marketing and advertising, and these costs are passed on to the consumer. Now in the US, we have a unique thing called surprise billing. What this means is that when you have a medical condition or an accident that needs treatment, you generally don't know what it is going to cost you before you go in for the treatment. You only have a vague idea. So you get the treatment, and after that, you start getting bills for services, medicines, personnel, facilities that the insurance company that you signed up with is not willing to pay for a variety of reasons. This is called surprise billing, and sometimes those bills are very high and the patient is responsible for those bills. On the other hand, low-cost public health insurance is available only to the elderly and the poor people. And the uninsured, who can get neither public nor private insurance, they become a burden on hospitals. How? When they become sick or they have an accident, they cannot legally be refused treatment. If they go to a hospital or emergency care system, they will have to be treated. But then who pays for it? They cannot pay for it. So these places, they turn around and pass the cost on to the employers and individuals who have private insurance. And that's how the cost of health insurance goes up and up and up, because not everybody is insured and healthcare insurance is very high. So in order to reduce the healthcare costs and to expand coverage, because if everybody is insured, then the overall cost goes down. In 2010, President Obama introduced or passed Affordable Care Act called ACA. But in spite of ACA, still 10% of the population remains uninsured. How does healthcare integrate with immigration? All full-time employees, regardless of visa status, are eligible for employer-sponsored health insurance. All citizens, permanent residents, and non-immigrant visa holders who do not have employer-sponsored insurance they're able to purchase insurance on the ACA marketplace. But under the Trump administration, many of these ACA features have been removed that previously helped affordability and coverage. Two important ones that are impacting immigrants currently are, until 2019, ACA required all US citizens and permanent residents to buy health insurance. Now each individual state can decide if its residents are required to buy insurance or not, which keeps the cost of health insurance very high. In January 2020, a new policy was enacted, which allows immigration officials to reject green card applications if they feel that the applicant does not have a way of paying for insurance, either by themselves or through the employer-sponsored insurance package. So the outcome of these November elections will decide for immigrants whether healthcare is going to get better or worse. So what was the impact of the pandemic on the US healthcare system and impact on people's access to healthcare? The United States has 4% of the world's population, but disproportionately has 23% of COVID cases and 21% of COVID deaths. I heard Professor Rao say that they are seeing that cases in the US are stabilizing. That is not necessarily true. And you will understand why it is not true later on in the slideshow. It has gone down in some areas, but it has not gone down in some other areas. The US really didn't expect the pandemic to take on the proportion that it did, because recent pandemics like SARS, Ebola, H1N1, they didn't really impact the US to this level. And so the US was really not prepared for dealing with this pandemic. And even after it became clear that this pandemic could become huge, the advice of scientists and epidemiologists was not followed, and the pandemic grew to huge proportions. The pandemic exposed many weaknesses in the US healthcare system. I will talk only about three major weaknesses. The first, federalism. It's a system of government based on decentralization of political power, which means states have autonomy of governance in certain areas. What this did was made each state respond to the pandemic in a different fashion and to a different extent. Many states were slow and inconsistent in their response. There was no stringent masking or physical distancing guidelines, or it varied from state to state. Travel restrictions varied from state to state. Some had complete travel restrictions, some had none, some had a mix. Testing was inadequately done all over the country. There was inconsistent messaging from public officials, and no one really understood the correlation between the virus and the economy, the spread of the virus and the economy. But some local government officials stepped up at the city and county levels, and they provided free healthcare to COVID patients, guidelines and mandates, and they prepared epidemiology models for predicting the spread, but this was restricted only to their jurisdiction and was a localized response. So this patchwork response and a leadership vacuum, because the current administration failed to provide early and comprehensive national guidance. All of this contributed to the rapid spread of the pandemic, and this patchwork response continues and the leadership vacuum continues, and therefore some areas of the US continue to see growth in COVID cases and some areas have stabilized. And there is no way to predict what is going to go up and what is going to go down. The second weakness was low investment in public health. Public health is in the government arena, and many Americans have a fundamental distrust of government and continually try to minimize the role of government in their lives. So public health got underfunded and under-resourced under this administration. There is an overemphasis on privatized healthcare in this country. There are no trained personnel needed for testing, contact tracing, etc. At least there weren't before. Now they have found a few other people. There is no national public health information system that enables resource allocation at the proper time to the proper location. There was no federal aid to states with a coordinated strategy or PPE, medicines, or other necessities. The third weakness that the pandemic exposed is a systemic structural weakness. It's an over-reliance on employer-based health insurance. What this means is when the economy crashed and many Americans were out of their jobs, they lost their employer-sponsored insurance. Some of them accessed free Medicare insurance, and some of them were able to purchase subsidized ACA marketplace plans. But a lot of them, over 10 million from pre-pandemic levels, have become uninsured at this point. So the number of uninsured is very high. The poorest, including racial and ethnic minorities, were affected the most by the pandemic. The healthcare industry suffered heavy financial losses. Due to lockdown and to preserve hospital bed capacity for COVID patients, all elective procedures were canceled. At the same time, there was a sudden rise in the number of COVID patients who needed very expensive specialized care like ventilators and other expensive treatment. So the two together resulted in huge revenue losses for many hospitals and medical practices, and mostly in rural hospitals, which are already financially weaker, and they suffered more losses. Unemployment rate in healthcare went from a low of 2.2% in February to a high of 10.4% in April to a current rate of 5.4%, and we'll talk about the dip in the unemployment rate later. The cost to consumers rose because surprise billing increased because patients had no say anymore in which hospital they were taken to or what treatments they were given. What were the efforts that were done by anyone to mitigate healthcare access during the pandemic, access of people to healthcare? Federal assistance was given in the form of billions to state and local agencies, billions of dollars, as well as to private hospitals and other medical providers to keep them going. In the public health arena, there was greater sharing of information, greater sharing of epidemiology models and other resources that led to localized coordinated strategies to deal with the pandemic. Two important areas became stronger: use of technology and the speed of releasing critical information. And the local governments opened up multiple testing sites to offer free testing. Many private insurers, they activated their emergency plans to make sure their members had access to testing and treatment. Hospitals converted many ward beds to ICU beds and also redirected all their other healthcare professionals to COVID care. So because of all this, there was some response given in the healthcare industry to COVID patients. What is the long-term effect of the pandemic going to be on the healthcare system? And this actually plays into what the job prospects are going to be down the road. Many scenarios have been predicted about the future of the healthcare industry. We don't really know exactly what is going to happen, but it is clear, very clear, that the healthcare system will undergo significant and permanent changes. The question is how and when. There are three main factors that will determine the shape of healthcare: success or failure of non-pharmaceutical intervention, masks, social distancing, etc. How closely are people following these? Success or failure of vaccines and antiviral therapies. There are many vaccines and therapies in the pipeline right now. No one knows what is going to work and what is not going to work. So when all that becomes clear, it will determine the shape of the future of healthcare industry. Secondly, the elderly and chronically ill, they comprise only 5% of the population, but they consume 50% of healthcare resources, which means when this segment of the population feels comfortable enough to going back to hospitals and medical practices and labs, it's only then that we can hope for a recovery back to pre-pandemic normal. Digital health has gained prominence and will continue to gain prominence, and it can partially compensate for the fall-off in the use of medical services, but it cannot compensate for, surgeries and colonoscopies, etc. So we believe the healthcare system could emerge less capable and smaller. So the pandemic response has differed from state to state. There are states where the pandemic response has been better controlled. And so the healthcare system in those states will see better recovery. In other states, it will not. Primary care practices, which is general practitioners, community health centers, and certain hospitals and providers in rural areas, they will most likely lose money and close. When they close, larger hospitals and practices could buy up these hospitals and practices, decreasing competition and increased costs. And these issues then may lead to increased government regulations and government aid. So what are the job prospects going to be post-pandemic? I believe that is of very high interest to this audience here. Let me talk a little bit about the unemployment rate in the US. Pre-pandemic, in January 2020, it was a low of 3.6%, as you can see in the graph. In April, it shot up, spiked to 14.7% peak. And in August, it has come down to an 8.4% because some of the economy opened up, but the rate of recovery has slowed down. So who lost the most jobs? Which industries lost the most jobs? Travel, hospitality, tourism, arts and entertainment, all of these lost jobs. I'll talk a little bit about these in the context of Houston, where I live. Houston is a major convention hub. It's a major professional sports hub, theater center. All conventions are canceled, no business travel, no hotel occupancy, professional sports being played without any live audience, performing arts centers and music halls are closed. Office population is barely there. It has dropped tremendously. Houston's economy is based on oil and gas industry. And guess what happened to the oil and gas industry? Fossil fuels industry saw 15.5% drop in employment. More than 1 million workers nationally are out of work in the energy sector. And it is predicted that the energy sector jobs lost will take a long time to recover. Banking, in-person banking is on the decline because nobody is going into the banks. Everybody is doing online banking. All the daycare centers and elderly care centers are closed. All the beauty salons and those types of businesses closed. Some of them opened up, but they're mostly still closed. Small business revenue has gone down significantly. Many low-income workers have lost their jobs and their health care. They cannot pay the rent and they could get evicted. The US economy is very dynamic, but they did not really expect the pandemic to hit it so hard and so fast. About 4 million US businesses are expected to close this year, and only 1.3 million new businesses are expected to be formed. Only 48% of the jobs that were lost have been recovered, and the rate of recovery has slowed. It is estimated that up to 8.7 million jobs will be lost permanently due to manufacturing automation, e-commerce, remote work, online education, everything going online. And jobs like retail sales, office, administrative, travel, hotels, commercial construction, they will be lost. The number of long-term unemployed is expected to increase to 5.8 million. What jobs can we see coming back at this point in time? Certain service sector jobs have come back. Bartenders, kitchen staff, delivery personnel, some beauty salons, dental hygienists, construction workers have come back, and I'll talk about that in a minute. It's very interesting to note that the residential real estate and construction market is booming and could boom for a little while, because working from home and people are working from home and their children are getting educated online, which means they need more space. So they're renovating their homes or they're buying bigger homes, and they can buy bigger homes outside the city center, far away from the city center for their previous office spaces, because now they don't have to commute anymore. And low mortgage interest rates have helped them to buy these bigger homes or to do these construction. So we're seeing a boom in residential construction and renovation. On the other hand, commercial real estate is depressed because there is no demand for office space or new hotels or convention centers, or anything of that nature. The government made some efforts to mitigate the economic losses. So, the Federal Reserve Bank and monetary policy. The Federal Reserve Bank introduced near zero interest rates, relaxed regulations, and implemented many other tools to boost the economy. For the first time in the history of the US, the Fed is directly lending to major corporate employers. They're supporting loans to small and mid-sized businesses and supporting loans to state and municipal governments and nonprofit institutions, and they're cushioning the impact of international markets. Congress also introduced, or actually passed, a fiscal stimulus bill, a $2.2 trillion stimulus package, which is the largest in US history, called CARES Act, Coronavirus Aid, Relief, and Economic Security Act. This includes money for vaccine development, paid sick leave, increased unemployment benefits, cash payments to individuals, forgivable loans to small business, just for payroll, not for anything else, aid for large corporations, and aid to state and local governments. So this is a huge stimulus bill that was passed, and there is another stimulus bill in the works in Congress being debated right now. What are the industries that will survive and thrive to the best of the information that we have to date? IT industry. Many companies have switched to digital operations during this period, and they may continue to permanently switch to digital operation because they're finding out that it saves them a lot of money. Broadband internet has exploded. We're talking in a Zoom webinar today because of broadband internet. All the remote working, the online education, the socialization, everything is being done using broadband internet. That is going to continue. E-commerce has gone up a lot because everybody is at home. They're ordering everything, food, grocery, medicines, everything is being ordered online. To that extent, a lot of large retail box stores have changed their operation models to cater to this huge spike in demand. The healthcare industry will survive and will grow. Telehealth is gaining a lot of prominence. It will continue. People are very happy with the ease of telehealth, so that is expected to continue. Pharmaceuticals and biotech, for obvious reasons, with this pandemic in place, already we are seeing a boom in these industries, and it will grow. Critical care, geriatric care, mental health, home health care, nursing, this caters to the 50% of the population, the elderly and the chronically ill, that will need a lot of care, 5% of the population that need 50% of healthcare resources. So this will grow. Renewable energy sector, driven by climate change. We're seeing a lot of effect of climate change in the US. We're seeing more and more hurricanes on the east side of the country. On the west side right now, we have wildfires raging over wide swaths of the country. Over 5 million hectares have been burned. People are driven out of their homes, and fire is still ongoing. Climate change will drive the renewable energy sector. That plus the slow recovery of the fossil fuel sector that we talked about earlier. And this will include electric vehicles. Immigration and jobs. I want to touch a little bit on immigration and how it relates to the job prospects. A little bit of statistics first. There are a total of 46 million people in the US that are foreign-born, and foreign-born workers make up about 17% of the labor force. A quarter of new businesses are created by over 3 million foreign-born individuals. And then we have a breakout of immigrants by their visa status, naturalized citizens, permanent residents, and temporary visa holders like H1, H4, F1, F2, U, or family visa. Incidentally, there are approximately 10 to 12 million undocumented immigrants, meaning immigrants with no visa status in the US, and many of them are Indians. Asian Americans, 20 million of the US population, they contribute heavily to the IT industry, healthcare industry, and small businesses. Asian Americans are people from the Indian subcontinent, plus China, Vietnam, Korea, Philippines, etc. So what impact did the pandemic have on immigrants? The immigrant population that suffered most was in the low-income service industries, agriculture, transportation, etc. But employment among high-skilled immigrant professionals has been largely unaffected. Immigration policy divides the two political parties. This subject, immigration, has become a hot-button issue in the US with diametrically opposing points of view. Under the Trump administration, a lot of policy changes were enacted. They're too numerous to list here, so I have listed only a few that might impact the audience here. There was a short-lived policy that required students to attend classes in person, and foreign students were threatened with deportation if they refused, but that policy, fortunately, is no longer there. It has been struck down. Temporary visas, all those H1F, H4, F1, F2, all those visas have been halted through the remainder of 2020. Many areas of legal immigration and visa applications, like green card applications or naturalization applications, have been suspended indefinitely, except for doctors. There is a new bill in Congress that is being debated, Healthcare Workforce Resilience Act. It has not yet passed. The bill is intended to increase the number of immigrant visas for nurses and doctors to help with the pandemic. So the healthcare industry will need a lot of nurses and doctors down the road. The Democratic candidate for president, and I talk about this because the November elections are looming, they're right around the corner. So Joe Biden has pledged that he will increase the number of visas for permanent work-based and family-based immigration. He will eliminate the limits on employment-based green cards by country. He will restore the naturalization process for green card holders, which is currently stalled or been suspended. Basically, if Joe Biden wins the election, it will be a better scenario for immigrants as opposed to if Donald Trump wins the elections. I will take a couple of minutes to talk about my personal experience during the time of COVID. We have had to make major changes in how we are conducting our lives, as I'm sure everybody in the audience has had to make major changes in their lives. We always wear masks and maintain social distance when we're outside the house. All our grocery, dining out, everything is done via outside pickup or home delivery. All shopping, medicines, items, anything is done online. Most of our doctor's visits are being conducted via telehealth. Clinic or lab visits, if they become necessary, only the patient is allowed in the building and nobody else is allowed. This impacts my elderly patients who happen to live with me. Elderly parents, I'm sorry. Socializing, we're doing mostly via Zoom or FaceTime. If we meet in person, it is limited to the outdoors. We don't take public transportation. All our entertainment is done via live streaming on YouTube. So COVID started in the spring and it is summertime now, and many people started doing outdoor activities like gardening, camping, biking, hiking, boating, which they normally wouldn't do if they had a way of going into bars and restaurants. So it's interesting to note that stores have run out of supplies for these activities. We are fortunate that we do not have children in school or college. Schools are open with a mix of in-person and remote learning modes. And many parents that we know have to worry about their children having to go in person. So these are some of the things that have changed for us. Some of these will go away when COVID threat is over, but some of these will continue. So the way of life will change permanently in many respects. And with that, we can take some questions.
Okay,
I'm going to now
madam,
stop sharing the screen.
For the wonderful talk. We have very, very interesting questions. So before our Honorable Vice Chancellor could give his views and put one or two questions, so let us take the questions as put by the participants. They are a few, but still so interesting. And we have a couple of questions we received in email. So can I start?
Certainly.
Please start.
Okay, number one, the first question is there any provision in the United States, particularly for the government sector, to compensate for the job loss or salary loss during the pandemic or post-pandemic scenario? Is there any provision which you are aware of, ma'am? Any idea? Yeah.
Yes, the stimulus package that I talked about, the 2.2 trillion stimulus package, some of that money was to give checks to people who had lost their jobs. They had to meet with some eligibility criteria and they would get a stimulus check. And they did receive a stimulus check for their job loss for about 6 months. And now that 6-month period is almost over, there is another stimulus package in Congress trying to get more money to these people who have lost their jobs.
Okay, so there is another question. How transparent is the United States government in terms of the real areas of expenditure as per the fiscal policies declared by the government, maybe federal, maybe state, maybe local, to recover from the pandemic scenario? How transparent is the government system in terms of real areas of expenditure? Any idea, ma'am?
The government is not transparent proactively, but the information is also not classified. So journalists are able to get the information. Journalists and other professionals in the healthcare industry are able to get this information and disseminate it to the public.
Okay. So there is one more interesting question, not directly related to your talk, but we can deduce it from your talk. Okay. Can Indian government, Indian authorities learn something from the practices, best practices or otherwise? What is the message from the US system of governance for India? Because you know both of our countries are democracies. One is the largest democracy, one is the most powerful democracy. So is there anything from the US system to learn? So this is one of the questions put by one of our participants, please.
As I mentioned in my talk, the US system of governance is a decentralized system. States have autonomy to decide how they had autonomy to decide how they responded to the pandemic. So each state responded in a different manner. Some states, like my state, had no masking mandate. My neighboring state has a full masking mandate. My state has no travel restrictions. My neighboring state has a travel restriction, but borders are porous. How do you prevent a nationwide pandemic when each state responds in a different manner? This is a learning experience. This is something that other governments should learn, in the sense that there should be a nationally coordinated strategy to deal with a pandemic of this proportion. That there should be national guidelines, there should be national distribution of PPE, ventilators, medicines. None of this happened in the US. So this is the learning that can be transferred to other countries.
Okay. Now one more question, that what is roughly the ratio of expenditure per individual or family at different strata of the US society? How do you look at it, pre-pandemic and post-pandemic? This particular idea that the expenditure, because you told most of it is private, this corporate, and the government spending is very less in comparison to what is expected of the government to be done. So for the individuals, for the family, and for the people in general, a different strata of the society, what could be the scenario in health expenditure per person?
Healthcare expenditure. Yeah. Healthcare expenditure, yeah, yes. Yeah. So people who have privatized insurance through their employers, who have not lost their jobs, they continue to maintain their insurance package, and their insurance package has not changed. So their expenditure has remained the same. People who have lost their jobs, they got some bailout money from the government, and they were able to get a little bit of healthcare. People who lost their jobs, lost their insurance, and don't have any money, they go to the public agencies that I talked about, the local government agencies that I talked about, where they don't have to spend any money out of their pocket. Their expenditure has not increased, but it has become a burden on the local government, which then has to, at some point in time, it will go into a recession possibly, and at some point in time, taxes will go up to fill the coffers of the local governments. So that is an inevitable curve that is going to happen.
Okay. Yeah, now the obvious question, when we talk about job loss or job prospect, now there are two questions for this. Ma'am, please take in turn. Number one, educational scenario. Most of the people from other countries, developing countries like India, China, and many other countries, their destination is US, the top-notch university in US. So now, pre-pandemic and post-pandemic, there is a sea change in the educational scenario, particularly for higher education, for research. So what is the view, your view regarding the people, the prospective students, maybe from India and from such other countries who would like to go there? What will be your suggestion, advice for these intending students? This is a question that can we still think of going to the United States or the top universities like Princeton, Johns Hopkins, wherever the people are supposed to go with scholarship, with fellowship, without, by spending their own money. So what is the advice, suggestion you give as a citizen there and who has seen the society so closely for decades and decades? Ma'am, please.
Sure. Educational institutions have suffered heavy losses, as have all other institutions. So as far as scholarships down the road, there may be fewer scholarships. But before we go there, let me just briefly say that after November, it will become clear which way the winds will blow. If Donald Trump wins these elections, we expect to see less number of immigrants, including students. If Joe Biden wins the elections, we should expect to see an expansion of the economy, an expansion of the colleges, more government aid, and expansion of immigration. So to answer your question, I would advise people to just wait till the end of the year to see which way the wind is blowing. Now going on to the educational institutions themselves, they have lost money. They may offer lesser scholarships. They may offer more opportunities to people who can pay their way. They may also have some programs where they offer online education, because now that the pandemic has opened the possibility for online education, many people may choose to do that. You know, you can live in India and get an online degree from a US accredited university. If that is possible, then people might do that instead of spending all that money. So all these possibilities are open, more open if Joe Biden wins and less open if Donald Trump wins.
Okay, ma'am. One question actually, you presupposed before I could ask. The question is that can we still go for real offline classroom education in the United States, or most of us, those, suppose I'm a student, I would like to go, I should search for the online education with top US institution. So what is your suggestion to such students? What we should try?
Right. Sorry, excuse me. Right now, colleges, some colleges, not all colleges, as I said, this is not a uniformly available option at this point. Some colleges have chosen to give online classes to students who prefer not to go in person. That is currently restricted to people residing in the United States, residing in the local area where the college is. So there are people who have left their homes to go to college in another city, but they're not actually attending classes in the classroom. They're living in their dorm rooms or in their apartments and taking online classes. So no one actually knows how far the online thing will go, but the possibility is there. It all depends on how the government reacts to the end of the pandemic, which government is in place and how they react to the end of the pandemic.
Okay, sure. Now the question, job. So, you know, already you have told there are people who are in the United States without proper visa permission, without the permission being granted officially, and their number percentage you have told. And there are people who have applied in different levels of visa and they are working. And as you told that people from India and this part of the world, mostly Asians, they are in which industries? So now in post-pandemic scenario, the question is, which are the areas the people who should go there, who should try to go there, and officially, of course, with proper permission, visa. So what should be the suggestion for those people who still have the great American dream they would like to go? So what is your view, your suggestion?
The industries that will see a boom, IT industry, the healthcare industry, doctors, nurses mainly, IT, all forms of IT industry will boom. Then there is the renewable energy sector. So engineers in the renewable energy sector. Oil and gas, I'm not sure that it is going to come back to pre-pandemic levels. So those are the three major areas that will see a boom. Now, there are other areas that might see a little bit of a boom, like construction and other areas, but these are definitely going to see a boom. So students who want to pursue careers in these areas should target coming to the US if that is their desire.
Yeah. So now there is one more question. There is one common belief that a large number of Indians are doctors and engineers in United States at present or pre-pandemic level. So as an insider, what is your assessment of the presence of Indians per se in these two sectors and other sectors like education, research, R&D, and other service sector? So what is your view as an insider, the presence of Indians? So how strong it is, or what is the nature of the presence of Indian doctors, engineers, and other professionals? What is your view as an insider?
Okay. I will try to answer this question to the best of my ability. I don't have actual numbers or statistics on the breakdown of by profession, but yes, we do have a lot of engineers and doctors in the United States that are of Indian origin. But it is interesting to note that these are people who immigrated many, many years ago. They have been here 30 to 40 years or more, like myself. Recently, in the last several years, we have seen more and more Indians going into other professions, many, many other professions like journalism, politics. There are many Indians in the political scene today that are running for office. Arts and entertainment, film industry, which is part of arts and entertainment. So there is a lot of jobs diversification in the Indian population in the last 20 years or so. And of course, the newer generation of Indians that are coming here, like young students or the people who are coming on H1 or H4, they are coming to the IT industry. So a lot of jobs are now that Indians hold are in the IT industry. Many, many Indians. So this is my personal experience. I don't have numbers.
Okay, ma'am. There is one more question I'll take up and I'll give it to our Vice Chancellor.
I have the time.
Yeah. So the question is, how much we can be optimistic about the so-called quote-unquote vaccines or the vaccines which are on trial, how much the world, including Americans and Indians, will be optimistic about the vaccines? Because in some of the news items we find the protocol is 9 months to 4 years before one vaccine comes from lab to the people. So how we should be assured that how much we should be optimistic about the vaccines, because in R&D also United States leads the whole world, and there are so many good labs and pharmaceutical companies are also there. So what is your view that how should the people be optimistic about such vaccine in your future or in some future?
Thank you. That's a very interesting question. And your guess is as good as my guess on this issue. Yes, there are a lot of vaccines that are being developed right now. There's a lot of research being done in different ways, some in like vaccine in pharmaceutical ways, some in viral therapies, viral vaccines, antiviral vaccines. So there are a lot of different ways of approaching the vaccine issue. My husband is in the biotech industry, and he's very familiar with how long it takes to develop a drug or a vaccine or something. But because everything is in an expedited mode right now, because there's a lot of talent, money, and resources being thrown in at this issue, we hope that by next summer, there will be something tangible available in the form of a vaccine that will actually be available to the general public. Now, you know, it's not enough to just have a vaccine. It's important to be able to manufacture that vaccine in large numbers and distribute it to the people. And then there are forces that could determine who gets the vaccine first, who is at high risk first, or who is at political risk first. And so there are a lot of things that play into that. But we're hoping that by next summer, there will be something that will bring confidence to people, that will bring hope to people.
Okay, thank you. So let's wait for the formal thing. Now I request our Honorable Vice Chancellor, Professor K.R.S. Sambashiva Rao. Sir, it is your turn. You can give your views, you can ask. Sir, kindly, sir.
Madam, the online courses, quality of online courses, and also the preference of courses which were done through online are by the employers is same as the physical classes and online classes.
I'm not exactly sure if they're identical, but I do know this, that the physical classes are given by the teacher in person. So the teacher has to prepare for that physical class, and the teacher has to then turn around and prepare another version for the online class. So there are two different versions of the same class that are offered.
Actually, no, classes are different, but what I'm just trying to tell is here, because no, totally there is a shift from offline classes to online courses. Now, how employer view is different?
It depends. It won't matter, because eventually if the college issues a degree, the degree is the thing that will matter.
They don't see whether it is a online course or it's a offline course.
Right. They will see which university it is from, what course it is, whether it is an accredited university or not. And yes, that's what will determine the employer's decision.
And regarding this health expenditure and everything, the private insurance which you are mentioning, no, even the companies are also under loss during this pandemic situation. Are they able to provide health insurance and total coverage to the people in America?
If they have suffered heavy losses, they just let go of the people. They just lay off the people. So the people then become unemployment, and they don't have to pay health insurance for them. So if they have money, they continue to employ the people and pay the health insurance.
This is because many people now expenditure, almost all people, they are now expenditure, heavy expenditure when they are admitted into hospitals. And even the claims also will be very high.
Insurance claims will be very high. Yes.
Very high.
Yes.
So the company is also under a lot of losses. So what is the response of those companies now? Because here in India, insurance companies, when we go there and claim, they will put a lot of questions, and finally they say that you are not eligible. This is what actually, even in movies also, we saw so you are not eligible because of this reason, because they have to pay some 10 lakhs, 1 crore.
Yes.
That kind of avoidance then will be more. So people are getting suffered now.
Yes, that is actually we're beginning to see that here also.
Yes.
Insurance companies are refusing certain treatments in certain hospitals and facilities.
Yes.
That is inevitable. That is going to happen. All around there will be financial losses.
Yes,
we just have not seen the recession yet.
Yes. I think because I was told that by some of my friends in the initial stages when New York and New Jersey is very high and it is now standstill. And other places, little bit relaxations, they got little high, but it will not be that much severity like New York and New Jersey. Mostly in America, what my friends used to tell, maybe in a couple of months, 1 month, 2 months, it may come down. This is what actually stands still. This particular situation may not be there like that. People are telling me. I don't know exactly am I correct or not. That's what I mentioned in the beginning. Because,
well, in what happened? I'm sorry, I didn't mean to interrupt. Sorry.
No problem. No, initially, because the highly populated areas like New York and New Jersey were little unable to control, but now they got into control. Now that particular areas were heavy populated areas. So other areas now which are having a lot of cases, they were not that much worried because the population is not that high in those areas where this particular situation spread now. So it may not be that difficult for America for the areas which are other than New York, Chicago, like that. That's what they were mentioning to me. That's what
Yes.
That's what I also mentioned. That's what I mentioned in the beginning also. That's what.
Yes, yes. So in New York and New Jersey, yes, it has gone down, it has stabilized. But right after New York, in Texas, it erupted to the same level as New York. Yes. So it all depends on, yes, it does depend on the population, the density of population.
Yes, density of population.
But it also depends on how closely the guidelines are followed, the masking and physical social distancing guidelines are followed, because we don't have a vaccine or a great cure at this point. So the thing about Americans is they don't like to do what the government tells them to do. So, but because the virus spread so rapidly, so badly. I can tell you my own experience in where I live in Houston. It went to the same levels as New York. And because it went to those levels, suddenly people started to die and fall sick. And then people started to realize, oh, wait, I should wear a mask. So then 50% of the population started wearing masks. But there are still other 50% who say, I don't need to wear, I don't want the government to tell me what to do. So it all depends on how closely people follow these guidelines. Yes, you are right that it has stabilized a little bit, but there are pockets of high rapid spread still coming up because people will not follow these guidelines. People are having big rallies, big motorcycle events, big car racing events where thousands and thousands of people are coming together. What happens when that happens? They all start to not just fall sick, but spread it to other people. So that behavior will continue. That behavior will cause spikes in certain areas. But like you're right, New York has controlled it, and now it is being controlled in Houston and in Texas at this point also. But Florida saw a huge uptick in pandemic cases. So you never know where it's going to spike next.
Actually, there is one Indian's point of view. This is under control because many people are taking a lot of care. It was also one feedback I got. Indians' point of view, because they are very much scared of, and they are taking a lot of care. Indians and staying at home and not been allowing their families to be affected by this. This is one of the feedback I got from the particular people, madam. Is it also true? I think, no?
Yes, Indians are more conservative about, more careful about this. They are being more cautious. Yes.
Yes. I'm very happy to know, heard from you that your husband is also in a biotech company. Why don't you help us to give one webinar to your husband also?
I will ask him.
Because I'm a biotechnologist, so I wanted.
Oh, you are? How exciting!
I'm basically a biotechnologist, so I now became administrator. So it will be very good for us. No,
Sure.
If you can help us know the biotech industry in pandemic situation like that, his experiences may be very good for audience, and also because we allow people from different parts of the country to listen to our webinars. Even we have now from Bangladesh and Malaysia, Ethiopia, Thailand, people are there now in the audience. So we are getting many people.
Oh, wonderful.
Yes, the first question asked by Bangladesh professor only. So we are allowing people from different parts of the countries. So,
wonderful.
So it will be good if you can influence your husband to give one webinar.
I will ask him.
Thank you, madam. Thank you. I
thank you.
Very much. I thank you very much for giving a wonderful webinar for our participants and to us. It's a wonderful, enlightening information, and we have a lot of lots of questions in our minds about America, people living in America.
Sure.
So because every family has got one or two persons in India, in America. So everybody has got feelings about America. So we are really benefited by your information. I thank you very much, madam. Thank you.
Thank you, Professor. Thank you, Professor Rao. And thank you, Professor Muthulakshmi. And thank you, Srinivas. And thank you to all the audience.
Yes.
This was very enjoyable for me also. Thank you.
Yes, madam. Yes, madam. Thank you, madam.
Can I end the session now? It seems Professor Pati is having some issue.
Yes, yes. Madam, thank you very much once again, because Srinivas Pati has got some problem. So in technical, so he cannot talk to you. So we are ending the session. It's okay?
Sure, of course. Thank you again and namaste.
Thank you.
Namaste,
Namaste,
madam.
Namaste.
Namaste.